Hello, everybody. Welcome to today's masterclass for Women's Health Week this time. So first of all, I would like to just start by acknowledging and paying respect to the past, present and future traditional custodians and elders of this nation and the continuation of cultural, spiritual and educational practices of Aboriginal and Torres Strait Islander peoples. Oh my gosh, do we have an epic conversation for you today? So to mark Women's Health Week, we are going to be talking about healthy aging and more specifically, hormones. Oh my gosh, even the thought of it makes me want to go and grab a block of chocolate. However, apparently there are some better ways to deal with these symptoms that us ladies experience post the age of around 40. So I'm really excited today to be speaking to a couple of experts who can give us some more insight into that and help us navigate these new health experiences that we get at this lovely ripe old age, and how we can indeed age more healthily. Now, this impacts everyone. It is not just gender specific. So whether you are personally going through these challenges and these experiences, or you know someone who is, this is going to be relevant to everyone. Everyone's got females in their lives, in their teams. So I'm really looking forward to cracking the lid, opening the can of worms, perhaps for some people on this subject, and then helping you understand, as I said, how to navigate it. So who do we have today? We've got a couple of lovely ladies with us. So we've got Sarah Di Lorenzo. Now, Sarah is a resident clinical nutritionist on the 7 network Sunrise and Weekend Sunrise. She's also the best-selling author of 3, soon to be 4 books for Simon & Schuster Australia. Now, I said soon to be 4. The last one came out on Thursday, so she's the best-selling author of 4 books. So we have the 10-10 Plan, the 10-10 Plan recipe book, the 10-10 Kickstart, and the new book, the Simple Recipe, the 10-10 Simple Recipe book. So Sarah's sold over 100,000 copies since 2022, which makes her one of Australia's top-selling authors. And she just told us that she's just signed for another 4 books, so she's going to be incredibly busy. Now, outside of her television and publishing roles, she runs a private clinic in Sydney where she treats and consults on all aspects of nutrition, from weight loss to chronic disease. We will, as well, when we're asking questions, if you want to ask questions, we've got some books to give away, some of Sarah's new books. So if you're thinking about asking a question, there's an extra incentive for you today, and we'll take time to answer those at the end. Here we go, the 10-10 Simple Recipe book with Sarah's lovely family on the front. And our other legend who's joining us today is Dr. Nicole Avard. So Nick, as I will be calling her, has worked as a general practitioner for over 20 years and has a special interest in integrative medicine. She's a principal GP at her own operated general practice clinic, Next Practice, on the lovely central coast of New South Wales, where I'm coming from today. So Nick has helped thousands of women across all age groups, and this has helped her to hone her wealth of experience in understanding the patient journey and meeting people where they're at. She is critically a member of the Australian Menopause Society. Nick harbours a keen desire for education and academic research. She plays a pivotal role in mentoring and educating the future doctors of general practice, and she sits on the working group for the Royal Australian College of General Practice Specific Interest Group for Integrative Medicine. She's also a clinical adjunct with the National Institute of Complementary Medicine with multiple published papers. So suffice to say, these ladies know a thing or two about menopause, hormones and healthy aging. So why don't we get them up and welcome them into the room? Hello, ladies.
Hi, Laura.
Thank you so much for being here. Yeah. I'm really looking forward to this. Even before we just jumped on, we were in a big conversation. So let's see where this goes. I'm really looking forward to this. Now, just a reminder, as I said, please ask questions. Cookie's in the background taking all of those, and we'll have that at the end. And we've got some of Sarah's new books to give away for those. So let's first of all talk about the impact of menopause. So Nick, I'm going to come to you first. Can you share some stats with us around the impact of menopause, and particularly the impact for women at work as well?
Yeah, sure. Thanks for the introduction. I'm just going to call out before I start that I'm going to name women in this conversation. But I'm speaking to females, assigned females at birth. So just kind of to call that out. The impact of menopause at work. Well, the average age for menopause in Australia is 51, menopause being when your period stops. Usually we count that retrospectively at 12 months. And there's a whole range of hormonal things that happen up until that age, which we'll dive into a bit later. So that means there's probably about 3 million women kind of in a perimenopausal, menopausal age group at any point in time in Australia. 20% of women will have a bit of a smooth time through it. About 60% of women will have mild to moderate symptoms, and 20% of women will have a really rough time of it. So at any point in time in Australia, the current statistics say that about 1 million women can be really suffering from menopause. Wow. And how that shows up in the workplace is that 50% of women can report reduced performance, work performance. 40% of women take more sick leave. 26% of women don't put their hands up for promotions or extra roles or responsibilities, and more frighteningly, 10% of women actually leave the workforce in this age group. And this is at a time where women are really kind of moving up in their career, they're at their most productive, and menopause is therefore impacting on the workplace. There's a great graph from the Australian Bureau of Statistics that shows at the age of 45, men taking on leadership and management roles continues up, and at the age of 45, women taking on management and leadership roles reduces like that, and menopause does have an impact on that.
And no doubt and we'll talk about this in a minute, but the impact on their mental health and their self-worth and all the things that come with that, which I'm sure exacerbate the symptoms. It sounds to me already like there's probably a big old cycle that goes on, which we will touch on in a moment. I'd like to just ask Sarah, from your point of view, in what ways do you see menopause affecting women's ability to operate, yes, at work, but also just in all areas of their lives?
I mean, I just loved listening to Nick's statistics, Em, because it's so interesting when I think about the patients that come into my clinic. And honestly, like all of the patients I see who are going through menopause, not one menopause is the same. So they all have different experiences. I have seen women come into my clinic who are CEOs, who are public speakers, who are people who have had an incredible career that start experiencing just minor symptoms. And I'm not talking about the sweats and the flushes and I'm not talking about those obvious ones. The little things like their performance and the anxiety that comes into the menopause-related anxiety, as well as the sleep impact. And then that comes into their confidence. And then there's the changes in their weight. And then there's the changes in their mood. And the thing is, a lot of women that I see come in when they see me, and they are confused because it's not who they've known themselves to be throughout their life historically. There's depression. There's a lot of other. I see things like that, and as it is, when you look at those statistics, you can see why they just don't have that support to be able to know that there's an ending, and there's just some strategies that they could do to work through those menopause symptoms, so they could keep on their career trajectory, all their relationships and different things. And then there's the confidence that goes with it. So so for me, really, one of the first things I would tell all these patients is just to there's that feeling of being overwhelmed and feeling of like, what's happening to me, and is this the peak of it, or is there worse to come? And I always tell my patients, just take it day by day and just don't overthink it. And then we will talk later on about some diet solutions and other lifestyle solutions. But my biggest thing with them is just to sort of not to exacerbate that frame that they're in. The thing is, a lot of patients will go to a GP, and as you would know, Nicole, as well, like there's a lot of antidepressants and sleeping pills that will be prescribed to women at this stage. So they end up going down that pathway, maybe before a different pathway, And so that's that point where I generally start to see them. But I also see women come into my clinic. I'll see 3 different menopause types, but I will see women come in around the age when they've noticed an irregular period. They've noticed that they haven't had it's like, oh, my period's, 6 weeks, or it's light, or it's heavy. And that I get that patient profile that comes in and that female is terrified of I think I'm starting menopause. I'm going to gain 10 kilos, lose my job. My husband's going to leave me, and I'm going to be 55 and overweight and insignificant. And so I get I get the perimenopause anxious patient who wants to come in and get the prep done. I'm ready for it. I'm good. So it's the point I'm kind of making is it impacts everyone's life differently because with their different symptom profile picture. But the biggest thing is, I think, is just giving people confidence to work through the stages of menopause without being scared of it, because we all go through it. We have to feel confident about it, not fearful. Yeah,
absolutely. So my question to you both is: do the ladies tend to know that they're going through menopause when they come to see you, or do they have one symptom that they just can't seem to get on top of and they don't necessarily realize that that's the menopause? What prompts them to come and see you is my question.
I'll take the lead if you want, Sarah, and then you can back up. But I'm sure the answers will be very similar from what you just described. I guess the first thing to discern is what is menopause, and then what's before and after that. So just to be clear, menopause is a clinical diagnosis. It's 12 months after your period has stopped. That is when you are menopausal. It's one day in your life, pretty much. For most women, there are some other medical circumstances like, say, chemotherapy or surgical interventions where you're thrust into menopause quite quickly. So some women will come in often inquiring about blood tests, and if you still have a womb, then it's really not that helpful to do blood tests for menopause, because it's 12 months after your last period, which of course we can only diagnose retrospectively. Having said that, there is a whole range of symptoms that can happen anywhere from 4 to 7 to 10 years prior to that, which is where women are often coming to see myself and I presume Sarah. And those symptoms can be kind of categorised into 3 main ones. The physical ones, which usually starts with a menstrual irregularity, whether it's a lighter period or a heavier period, the beginnings of sleep disturbance, hair thinning, weight gain, joint pains. Then there's a whole realm of psychological symptoms: irritability, anxiety, depression. Depression can be really quite significant. Brain fog, difficulty concentrating, difficulty staying on task. And then there's a whole realm of symptoms that's often not even spoken about. So what we call the genitourinary symptoms, so frequent urinary infections, frequent urination, changes in sexual relationships, vaginal dryness, vaginal irritation. So women will usually come with the first 2. It's not common that women will come into my treatment room and bring up the third one, but it's important to be spoken about. So they usually come with physical symptoms and or some often concurrently psychological symptoms. And to your point, Sarah, you're right, there is prescribing of other medications, which sometimes can be helpful in this age group. But I feel like the medical system is in a space where general practitioners don't have enough time to unpack all of the nuances of the menopause journey. And it's really quite difficult to kind of maintain a patient-centred holistic approach in the system that we're operating in at the moment.
Yeah.
And so, sorry, Sarah, just a real quick question, and then we'll come to you on this. Well, actually, you can answer this one as well. So all of these symptoms, I guess, could also relate to stress and other things that are happening in people's lives. And correct me if I'm wrong, but typically women don't prioritize these things and put it off and start to think that things are normal. And it's not until the proverbial hits the fan that they go and seek some assistance. So at what point can women go, actually, no, I don't think this is normal? Is there an answer to that? I'm not sure. How can we?
I think that's really individual. I mean, I think as individuals, it's what are you prepared to tolerate? A lot of people I see as mothers, as wives, as employees, whatever it is, a lot of it depends on how busy your life is. I always feel like we should stay on top of our health because you can just end up getting burnt out. And so people might find that some people have a high pain threshold. Some people can cope really well on their adrenals and manage stress really well, whereas others can't manage stress really well. Then you don't know how much sleep someone's having. You don't know if there's a domestic violence situation. You don't know if there's children who have been there. So there's so many. It's like Nick said, there's just not enough time. There is so many variables that come into this on how this affects a woman's hormones. I mean, I always look at things holistically. For me, sleep, stress, relationship with food, alcohol, caffeine. There is a plethora of things that will impact someone's hormones and someone's health. And as I said, we are all in a different socioeconomic situation, employment situation. There could be deadlines, stress at work. There could be relationship pressures, death, divorce. Divorce is very common. So there's all these other things. But for me, back to your original question, for me, given my history as an author and specialising in weight loss, I get the patient a little bit different who has for no dietary changes put on 3 kilos overnight, and they're like, I haven't changed my diet or my exercise. And then I explain to them, well, you're losing some estrogen, so we have to recalibrate your calorie intake. If you want to stay at that weight, then you've got to reduce your calories a little bit. So how can we do that and still keep you healthy? And so I get a little bit more of that person that Nick necessarily wouldn't get being a busy GP. I get the patient that really wants to try and stay on top of their weight because their clothes doesn't fit them and they feel awful, and the weight's impacting their mental health and they just don't feel, and that's impacting confidence. So as you can sort of get a feel of it, Laura, like it's a huge topic, and and I love the research, and I love like the studies being done for people to be able to connect to, so they can sort of look up their symptoms and see. But as I've experienced, like I see some people who have only the physical symptoms. I've seen people who go through menopause who don't get the vaginal dryness, don't get the UTIs, they don't get the anxiety, they just have, I've just sweated a couple of times and I was good. But then that comes into, well, why did that person get that and the other person didn't? And that's a whole nother, that's a tangent I could go on.
So many variables. And I wonder, do you think this is why this topic hasn't been spoken about so much before, because it can't be generalized? Is that part of the challenge, do you think?
It can't be generalized, but we do like those 3 categories of symptom profile pictures. And I think this topic is just so important. And for me, being a part of what we're doing today in Women's Health Week, is I want women who are incredible and they're strong, and they've got, I want women to embrace menopause as I don't want women to feel scared of it. I want women, I love the way, as I've told you before, Laura, I love the way Maori women manage their menopause and Japanese women manage their menopause, and First Nation Australians, how you can look back at the history. There's not even words for hot flushes because they are celebrated as women who are now elders, and especially with the Maori tribes, they're celebrated for being spiritual leaders because they no longer have a birthing role. They have a role now as a spiritual leader. Japanese women, there's not even a word for hot flush because of their diet. They've got the diet high in the phytoestrogens, and they've got a lot of omega-3. They don't have processed foods. They have a lower inflammation, healthier weight. I mean, they've got other issues, more stomach cancer and things like that. But when it comes to, you look at it, the women, and that's where I love studying the diets, when I looked at different cultures. So, I think it's fascinating, and I think there's a lot we can take from that. But that's sort of going into a little bit more nutrition now, which I know we'll touch on a bit more down the track. So I'll keep going.
I'm curious. This is a semi-tangent, but I'm curious to hear both of your thoughts on the reason that you think there is a stigma around menopause in this culture, and what you think we can do for ourselves, but also for others, for our team members, females in our lives, what can we do to then start to manage and overcome this stigma?
I'll let you go in first, Nicole. I've got my answer, but I'm
how topical can I get? Look, I think the reason, maybe I'll flip the question upside down if that's okay. We're generally becoming a lot more health literate, and as women, we're moving into the workforce and moving up into higher roles. So I think there is an empowerment towards, looking after yourself when you're in your 40s and 50s and 60s. And it's a really difficult time for women at that age. They've often got young kids or teenage kids and aging parents, and they're feeling like they're a sandwich generation. So there's a lot of spinning plates that often prompt an inquiry into how to stay well through that phase. And I think there's also an element of, to the point of the spiritual leadership, like empowering. Like, say, for myself, I want to empower myself so I can model good health and good care for my children and other young women around me. So I think in terms of a kind of systemic construct, I think we're starting to break that down a little bit to have more open conversations. And the research world is catching up. There's still actually quite a dearth of research in menopausal women, and I think that has helped promote a stigma as to why it's not spoken about. That is kind of, again, being broken down as a construct, but there's still plenty of work to do, right? I think we're forging our way forward to start conversations and make some positive changes for ourselves. However, there's still more work to do.
Yeah, I sort of feel like it's one of those situations with menopause. It's almost like, giving birth as well. Like women, everyone shares their horror story, and you don't really hear a lot of people tell us. They do. Like, so if anyone who's having a rough time, and I remember my mum I remember standing with my mum in the bank, and she's like, carrying on, like, together. Or I'd go into my mum's house and I would be like wearing a parka because every air conditioner was on. And I just think that it's one of those things as well where everyone will tell you how bad it is, but I still see patients as well on the flip side who have an amazing menopause. I see women who go, in my every initial consultation, every single initial consultation, one of my first things with a female is if they're postmenopausal or ask them about their menstrual cycle. And I can honestly say that there's a lot of patients I see who go, oh yeah, it was no problem at all. I just stopped menstruating. I didn't really notice much. I think maybe I sweat, and so you don't hear that. So I think the stigma comes with so many, you're seeing that visual of women, frazzled and all of. And the other thing I see as well is women who get very concerned about their changing body shape because we get that belly. So there's all of a sudden women are like, I've always had a flat tummy. And, I'm like, well, you're going to go from a pear to an apple. It's just the way it's the hormonal positioning of fat. You're going to start getting more of that fat, which is giving you more of that apple shape. I mean, I love going when I'm at the beach, sometimes I can lay at the beach because I live at the beach, look at women's bodies and I go postmenopausal, premenopausal, post-P. I can pick all the bodies.
Gosh, you're never going to be able to go to the beach now. Everyone's going to cover up when they come near you.
That's it. You're going to, Sarah. I'm just so you're aware.
You can see their body changes, but that concerns a lot of women. So you can see with you and I, Nick, how we see such a different side of it. I probably see more of an aesthetic, like, oh, my weight, whereas you see more of the, I mean, I still do anyway, it's fascinating. And it's really interesting. But I definitely think that my biggest thing is just, as I said before, I want women to feel confident that they can find strategies to get through it as best as possible without being, and I want to take the fear out of it because it's not going away. Fear won't, it's just.
Well, and that. That's a good segue. Sorry to cut you off there, Sarah. That's a good segue into what I wanted to ask next was, how much does fear, you've mentioned confidence a few times, Sarah, and this kind of mental behavioral side of things, how much does that feed into the symptoms, and does it exacerbate the situation? Again, we spoke about stress. So does this fear, this stress that comes along with menopause, actually then feed into the symptoms and change the experience?
Okay, so in my opinion, absolutely, because when you fear something, you focus on it. When you focus on it, you put energy into it, and you'll look for things more so. It's like the power of the mind. I mean, I know that there is the very real physical symptoms. I'm not taking that away from it whatsoever, but mindset is very powerful. I mean, you can wake up in the morning, you can take a few deep breaths and just say, and just start to kind of think, I'm going to do the best I can to get through this, and I feel confident, and this is changes my body's going through. I feel education is key with everything that Nicole's doing. I think when people are educated about what they're going through, and they have a protocols in place or a plan in place or some supplements, exercise, diet, they'll feel more confident. I know my patients, when they say, right, come on, let's do this. Well, here's your plan. We're going to work through this. We're going to make all these changes. I'm going to ask you to give up alcohol for a period of time. We'll just see how it goes. We'll, and when I feel like that, you just work through it. I've got about 10 patients popping into my head right now who I did do their menopause with them, and they're amazing. And we just work through a plan, and I did ask them to make some changes, and they were all of it. I'm like, how's your menopause going? And they're like, what? Oh, that. Oh, yeah, good, fine. But that was working side by side with people in a clinical setting, and there's a lot more to that. But I've just
supporting them through it.
Yeah,
Nick, I'll come to you on that one.
Look, I agree with Sarah. The cortisol or adrenaline response to fear is going to impact on your other hormones. So, and it's, I think I would divide it into, almost quantify it as a bit of a vicious cycle, because women, in my experience, women can feel like they've totally lost their sense of self in this phase, and they are at sea with new experiences that they've not experienced before. And so that is obviously going to drive fear, or sourcing different information that might drive fear. There's a whole range of circumstances that might drive that, which then just kind of undermines the sense of self and empowerment that can help them make the right choice at any point in time to navigate the next day, the next week, the next year.
Yeah.
So on that then, Nick, how can when we start to experience these symptoms, then we start to experience this fear, this anxiety that Sarah was talking about before that comes with it, what are some ways that we can manage that so that our day doesn't spiral down? Let's put it in a nice way. Go to hell.
Just to most women's days don't go to hell, so that's good.
Excellent.
But it's tricky. I guess I would divide this into three categories. The first is source accurate information. So empower yourself with accurate information so you can make the right choices for you at any point in time. And I kind of wrap that up with a big blanket of self-compassion, because it's a really tricky stage. So hold lightly, kind of moment by moment, with a big blanket of self-compassion as much as possible. I struggle with that, so I get how that's tricky. It's always a holistic approach. So having a think about or working with the health professional on how are you sleeping, what food is going in, how are you regulating your stress levels, or how's that sitting for you, what is alcohol doing, what are your movement choices. Like it's and I don't want to say that in terms of giving women more things to do. It's just more about reflecting on at any point in time what kind of choice points there are in a day that could pivot. And the classic example I use is, for example, if you don't sleep well because you're hot flushing at night, then you'll be tired in the morning, you're less likely to get up to move, you may be busy through the day, so you're more likely to reach for refined food choices. And then at the end of the day, you're tired and stressed because it's been a big day, so you'll reach for a glass of alcohol. So at any point in time, those things can be changed, but it's the sleep that drove all of those choice points. So it's kind of working with someone on where do you think you can start that's achievable for you, that's not going to set up a cycle of failure. And then there's the conversation around hormone replacement therapy and menopause hormonal therapy. So it used to be called HRT, now getting shifted toward MHT. And far and away, it's the most effective treatment for treating hot flushes and other physical symptoms and some psychological symptoms for menopause. And we could spend another whole topic on MHT because, again, that is quite a complicated kind of conversation. But very briefly, the landscape has changed from the Women's Health Initiative that was done 15 years ago that kind of blew it up in the water to now it being quite a safe and effective way of helping women through the menopause transition for a whole range of reasons.
Yeah.
Sounds.
I was just going to say on HRT, I always, when I get up, my patients ask me about it. For me, you know, at the end of the day, the first and foremost thing for me is if that's going to make you happy and that's going to bring happiness back into your life. For me, when I'm treating people, some of them are in that situation exactly like you've discussed, Nick, where they are just completely crippled by it. And I always say to them, and then they'll come in and they would have started, and it's the migraines some people get too, like. And for me, and it's also their relationships too, their libido, which we haven't mentioned, and there's that complaining, and there's the lack of libido and all of those symptoms too. And for me, the biggest in life for me, number one, you have to live every day and love it and be happy. And if HRT is a solution, it has come a long way from what we would have known 20 years ago when people were saying HRT gives you breast cancer and all this kind of stuff. There's a lot more information on it now. It is evolving endlessly. And I always say to people, maybe explore that avenue because, number one, you got to enjoy life. It's short and it's fabulous. And you've got to really, and for me, that's a little bit of me just on my views of HRT. Because at the end of the day, happiness is everything and enjoying life. And yeah, it's interesting. Yes.
You're right,
Laura.
Are you there, Laura?
A little break up there, sorry.
Are we
back in the room? We're back in the room. But actually, I love that, Sarah, because that feeds into what we were talking about before as well in terms of fear and how fear can then exacerbate the symptoms. So understanding what makes you happy, and then, as Nicole said, focusing on those key things can really help to then minimize the symptoms, right, and help you manage and navigate them as easily as possible. And I loved what you said as well, Nick, around focusing on just one thing to start with. So whether it is the sleep that's driving everything, whether it is the hormones. And so MHT, is that correct?
MHT, well done. So menopausal hormonal replacement therapy. MHT now.
Whether that's the focus, whether it is the hormones that are driving most of the things, whether it is behavioral situations, stress or whatever. I love that just finding one key element and focusing on that first can be a great place to start. Because let's face it, we are all busy. There are a lot of different symptoms and things going on. So I think focusing on that one thing can help give us control, which I think is what can help make us spin out of control when we feel like what's going on here we have no control over. So I really love that. So for the audience out there, maybe that's a nice place for you to start, is trying to identify what's the one thing that's actually driving my symptoms, my behavior, my thought process, my anxiety, whatever it is. Maybe I can start by just getting some help with that. And on that, Sarah, obviously nutrition is one massive area that people can focus on to start getting some control and managing the symptoms. So can you give us some tips, some information on how people can use nutrition to manage these symptoms?
And yeah, absolutely. And what I will say is the women that I do see that have a really good menopause are ones who have a very healthy diet. So the ones that I do see who are very just a good balanced diet with a lot of whole foods and real foods. The women I do see that suffer their menopause are women who have a lot of refined sugar, lots of caffeine, spicy foods, alcohol. They're the ones I see with that symptom profile picture a lot worse. And in my clinic, I will get women that come in, and I loved hearing you, Nick, talk about your menopausal lady driven by sleep, because I can tell you a snapshot of a day of my menopausal lady. She wakes up, and I call it the 3 W's: wake, wee, and weigh. And then she goes, right, I'm going to be skinny today. Today's the day. She's tired because even though she's tired, she's woken up with a little bit of like, I can do this. 3 coffees from the barista, there's 450 calories. They're large, like lattes, not counting liquid calories. Tuna and salad for lunch because she's on a diet. She's probably fasted till lunch. Come 4 o'clock, the cortisol's dipped. It's all a little bit too hard. Everything's caught up. The diet hasn't been healthy whatsoever. There's been probably 100 grams of meat with about 30 grams of protein in it for lunch and that can of tuna. Then she'll pick up the kids from school. If there's young kids, she'll start eating in the afternoon. She'll get home. It's all too hard because she's binged in the afternoon from not eating properly. Then the wine comes out. Then the wine impacts the sleep at night, and it goes on and on and on. And she's eating the kids' dinner, the husband's dinner, eating it.
And all the chocolate.
The chocolate at night. So that I see that's such a classic picture of a menopausal lady. So when it comes to diet, look, I always get people, as I said, just slow and steady. We just start. So I always encourage women as a trial, because a lot of women, I would say 70% of adult females consume alcohol. Now, 1 or 2 glasses a week is fine, but if you are going to be consuming 3 to 4 glasses of wine a day, your menopause will be a lot worse. It's just, and so I always say to women, just try, let's just do it for a month. Like, I don't overwhelm people. So minimize caffeine, because that leads to the flushes. Take out spicy foods, caffeine, and then we just really take out all the refined foods or junk food, fast foods, fried foods. And we just start, and then I just start making some dietary changes with them. So I just start looking at trying to get the phytoestrogens, trying to encourage them to eat things with just looking at tofu and soy-based products. And there's a whole conversation on soy, which I could go into, but I won't. But I just start to get them to do a healthy meal plan, and we just work through it slowly. And we just look at just getting portion controlled, healthy meals, the 2 pieces of fruit a day, the 5 to 7 serves of veg, making sure that there's some good protein with each meal and something every 2 hours just to get the metabolism moving along. So I work with them with those dietary changes, but I do say to them, if we're going to commit to this, let's just really move out all of that stuff. And the changes, because so much of it in menopause is driven by inflammation. And when you're putting a lot of anti-inflammatory foods in there, when I'm getting them to have a tablespoon or 2 of olive oil a day, there's all that oleocanthal in there, which is known to act like ibuprofen, which is a compound within olive oil. When you just put that in, and then you've got 3 or 4 times a week of just some, making sure that there's things like avocado, walnuts, fatty fish, salmon, mackerel, etc. Good study was done on women who did the Mediterranean diet, and they showed that their menopause symptoms were 20% less. There's a lot of, and encouraging women to eat legumes, and again, portion controlling it so that they're not overeating all these kind of complex carbohydrates as well, maintaining a healthy weight. So there's a lot to do it. And I always encourage them to, move the complex carbs to the front of the day. We still want to make sure our cardiovascular health's there. So we look at things like making sure that their cholesterol can be regulated by good fiber. I also make sure that there's sesame seeds, chia seeds, and then we're looking at the calcium, making sure there's good calcium outside of just drinking cups of milk and eating slices of cheese and cups of yogurt. So making sure that I'm building up their calcium. So at the same time as looking at their cardiovascular health, because they're postmenopausal stuff. So I do a lot of things, but I do it step by step. But dietary changes far and by large, and it's as simple as inflammation will make menopause worse, and lowering inflammation will make those symptoms a lot better. And that's just my clinical observation. So
if someone was to start then, sorry, I think we keep cutting up a little bit. So if someone was to start with their nutrition then, Sarah, as a broad kind statement, an easy way for them to start, would you say to just clean it up, to get rid of the processed stuff, the refined sugar, and just get as much natural produce in as possible?
Correct. So I would say to people, right, let's just take it step by step. Let's just look at week 1 as just starting to empty out the pantry, set some goals. I get them to work through stages. I love setting goals. I will get them to work through phases. I'll just first and foremost, we address the obvious things like, take away refined food. Sugar's a huge one, the pick-me-ups, all that kind of stuff. The snakes in the staff room, the arrowroots in the afternoon, the vending machines. Soft drinks are an absolute non-negotiable. Alcohol's not negotiable. Caffeine minimised, and they're the things I just start to really look at in the first week. And then I'll just say, right, let's look at what we can do for breakfast. And we'll just start with a breakfast, and then we'll just sort of start moving into, and then we just go through it. Probably over about a month, I would get them to make those changes and set reminders, set goals, keep diet diaries. The worst thing is overwhelming someone because they'll go, oh, it's too hard. I need a glass of wine. I can't do this. And so I don't want to do that. So I work through stages. So, yeah, it's a step-by-step process, as I said, but, yeah, first and foremost would be cleaning up the diet. And then, as we get into it, we start to focus more on nutrition. We'll start looking at more calcium-rich foods and cardiovascular support. But that's a little bit more towards a maintenance phase, but then, and a lot of it is just really supporting those detox pathways as well, making sure that the body's working well, the body systems are working well.
And so,
yes.
So sorry to cut you off there. Apparently my internet's a bit weird today, so I apologise to everyone. Yes. Joys of living on the Central Coast. So talking of that then, Sarah, we were talking about support. So can you both tell me, number one, how important is support to get us through this, both in terms of our personal life, but also our working life within our teams, and then how we can ask for it, which is the key, right?
I'll let you go first, Nick, because I've been chatting too much.
Well, look, in my point of view, life is a whole range of things, and relationships is one of the most key ones. So I think support, particularly at this point of time, is imperative. And support may look like, friends and family around you. It may look like colleagues at work, both male and female. It may look like a health professional, health practitioner that's going to help you navigate the journey and help you with the choice points at any point in time. But it's imperative, and I think more sessions like this, just starting a conversation, just starting a conversation is the best way to ask for help. Yeah.
And what about in terms of teams? So, sorry, Sarah, just in terms of the teams, because I know Metluma, your company, Nicole, you're looking at helping teams with this situation, with the menopause situation. So again, how can we ask for support at work, and how can work support its team members?
I think it's just having open conversations around, these are the experiences these are the symptoms that I'm experiencing, whether it's with your colleague or your manager. Can we start a conversation around how I could be supported in the workplace to help me manage these symptoms, because it's impacting on my work. They're not easy conversations sometimes, but until we start the conversations, the construct and the stigma is not going to be broken down. Yeah.
And is there education out there for the managers to be able to deal with these conversations and situations?
Well, we have a product that can help people, but at Metluma, there's plenty of resources out there that can help managers negotiate that. I'm not going to. It depends on what the conversation is as to where you look for the resources.
Okay. Yeah. Okay. So Sarah, can you talk to us about the support piece as well, and again how we can ask and give the correct support?
I think it is growing. I mean, I think when we talk about things today in 2023 that, they would never have been spoken about in my grandmother's time. You just wouldn't talk about it. Almost swearing. I remember my grandmother even saying the word period was like a swear word. Like it was like you just didn't ever spoke about it. So look, we are growing with it. It's becoming a lot more accepting. We are all individuals in what people are, how they feel about their privacy, how they feel about their health. It's very individual for people. that want support. I imagine that, you know, I haven't looked at it, but I imagine there would be Facebook communities. There would be online. All you would have to Google is some kind of community support, and I'm sure lots of things would pop up. Outside of that, for something more personal, maybe look for a healthcare professional of your choice, be it a GP or a naturopath or a clinical nutritionist, a psychologist. There is a lot of organisations out there that will help you depending on what you are. I think it's individual. I know some people are just would, you know, openly talk about it, and other people are incredibly private about their health and might want to just manage it through professionals. And then lots. I mean, look, the research is there. There's heaps of books out there. There's great organisations like Nicole's organisation, which are really at the forefront of bringing this out, which I'm so impressed by, and I think it's something that is so important. Having a voice, I think it is starting the conversation, be it with a friend or a colleague or someone just saying, "Hey, I'm not going well. You know, I'm not feeling confident. Do you know anyone I could talk to?" And then you can maybe look at that practitioner and see if that's the practitioner for you. Often you've got to find, and I find that a big one, is that the right practitioner for you, for their advice. And remember who you're getting your advice from. Is that the kind of, you know, how do you, if it's that person's area of expertise or not? But yeah, I think it's just I think it's just starting with the conversation with someone that you feel safe with. If it's be it feel safe to talk about your health and just say, this is what I'm going through. I mean, I'm someone who's complete open book about stuff like that. Like I feel like there's nothing, I mean, I want to encourage women to feel confident and celebrate it. And I'm going to say it actually really, when I think about what menopause does to some women and how hard they've worked with education, with working their way up the ladder, I've seen them as my patients. I actually find it quite heartbreaking that I can see some of these women who are on their knees with this with menopause, and I just would and like fall into that 10% where they just end up, you know, becoming losing their job or something. And I find that's the side of it as well that that really upsets me, with women who haven't really got on top of it, who just became that statistic to fall through the cracks and lose brilliant careers or relationships or different things, when there's just so much help out there. Walk into a bookstore, there's books, there's online programs. If you Google menopause, it'll be like the 28-day menopause. Like there is Google, there'd be like
a plethora.
I reckon there would be 1 million Google searches on it right now. Just have a look, you know.
And speak up, right? And
exercise. I always say, I forgot to mention that. Exercise is not only a natural antidepressant, but it puts you in a good mood for the day. And women who maintain their level of exercise at least 4 times a week of 45 minutes of cardio, I find that they do a lot better as well with the symptoms, all symptoms. That was, I think.
The word that keeps coming up for me as well when you're both speaking is the word control. And I think, you know, doing your exercise, seeking support, reading a book, you know, doing an online program, seeing your GP, just again, as Nick said before, doing this one thing, I think gives women control, which is the thing we feel we're losing when we start to go through these experiences. So yeah, that was the word that keeps coming up for me, control. What's one thing you can do to feel like you're taking control of the situation, and then the rest will start to snowball in a more positive way from there, one would hope. So look, let's go to questions. I'm sure there's plenty of questions out there. As we've said, it is a minefield. Okay, how do we handle the psychological symptoms like anxiety, etc., that Dr. Nicole mentioned? Great question. Thank you.
Great question. And once again, I always take a holistic approach to this. So unpacking what are the sources, are there sources of stress that are impacting on the sensation of anxiety? How is sleep going? Is there movement going in that can help? Because as Sarah just said, exercise is an excellent remedy for mental health. And then there's a conversation around MHT because it can definitely help with improved sleep and also help with the psychological symptoms of menopause and the perimenopause transition. Depending on the circumstances, there may be conversations around other medications, but once again, it's a holistic approach of alcohol, caffeine, sleep, movement, and then a discussion around MHT and the impact that may have in terms of reducing the sensation of anxiety.
I guess that's an important point.
Of course, there's also engaging other allied health professionals such as psychologists to help with CBT and other psychological modalities.
Yeah, that's what I was going to say, Nick, is I guess these symptoms, they're not just from one thing. It's not just psychological. It's not just physical. It can be behavioural as well, right? So it's understanding, like you said, to take a holistic approach so that you're kind of tackling it from all areas. Let's go to this question from Barbara. So how do we find the right GP to talk to about this? Is there anything we should be asking them to get the best results? Great question, Barbara. Thank you.
Great question. So the Australian Menopause Society has on its website a list of GPs that have taken a special interest in menopause and women's health. So you can look up their website to find GPs that are specifically trained in the menopause health journey and identifying it. I think just ask your GP the question, could this be menopause? Arm yourself with the symptoms you're experiencing and then kind of do a bit of an audit around whether those symptoms are possibly menopause related and simply ask the question.
And if you don't get the answers, then don't give up, right? And go and find someone who you feel does listen to you and you can resonate with, rather than then going away and suffering.
Yes. Yeah, agree.
Okay, what vitamins, or vitamins, as I probably should say in Australia, do you recommend for symptoms of menopause? What do you think of Femula? Should we come to you for this one, Sarah?
I'm not familiar with Femula as a supplement, but as far as supplements go with my patients, one of the things I always get them is magnesium, just that it's a really can work with anxiety, musculoskeletal, it can help with sleep. So magnesium is a big one. I get them to look at definitely omega-3. So I'll supplement them with fish oil to drive down that inflammation. I look at different things like that. I'm not a big over supplementer, but I will definitely get I will look at things like we will look at calcium if they're not getting enough for their diet, or if their diet's not great, if I do need to supplement. But I look at their gut health as well. So I always sort of say to them, it's really important to. So I might with a lot of them, I might do a probiotic. So just a general broad spectrum one, and just sort of start working on that gut bacteria to make sure it's, we're getting some good bacteria in there, and then obviously look at the foods to feed that, or the prebiotic foods to feed the probiotics. They're kind of the main ones I look at. For energy, I would be looking at something like CoQ10 in the morning if we're looking for a bit of energy to start the day. And then just that immune support as well. I'll always do a little bit of vitamin C. I know it's very 1970s and everyone loved vitamin C in 1970, but I always find that's just a good one just to make sure that their immune system is working well, the antioxidant support. And I also do focus when it comes to antioxidants, I do, because there is a lot of that brain fog. I look at cognition as well. So I will definitely look at making sure that there's that general antioxidants that you will find in vitamins A and C, but also from diet. Like I get all my menopause ladies to have half a cup of blueberries every day in their dietary plan. High fiber works with bowel. So there's a few things, there's different things. And also just there's other supplements you can look at. It's even adding psyllium husks to the diet. I mean, that's just very broad. As I said, every patient's individual, but the key ones are probably a bit of CoQ10, magnesium, and omega-3. I mean,
Great. Thank you. And so last question then, we've got Renee, are there any promising advancements in menopause research or treatment on the horizon?
Well, that's a great segue, isn't it? Yes, there are. So thanks, Renee, for the question. So Metluma has partnered with Western Sydney University, and we're currently running a trial to validate the feasibility of a menopause smart health community, where we'll be offering a digital kind of education component, group coaching and one-on-one coaching led by myself and supported by a nurse. So if you're interested, we're looking for participants in that trial. So if you're interested in joining, jump onto our Metluma LinkedIn page, and the link is there to answer the questionnaire. And yes, there is, my point earlier, there is more evidence coming out in terms of treatment options. There's definitely new products soon to come onto the market, particularly for hot flushing, that are not hormonal related, that are working more on the hypothalamus. So it's an area that is growing, but still more work to be done.
Thank you so much, ladies. As we said at the beginning, this is a huge subject. Just to give you takeaways, I think that I'm taking from it, really, it's just around what we spoke about, focusing on one thing, so understanding what's your level of normal, and therefore if it's not that, what are you experiencing, what's impacting you the most, and then who can you speak to, where can you get support, so that you can start to take control of the situation and get on top of it before essentially it gets on top of you. That's a very down way of looking at it, but this idea of taking control, understanding yourself, understanding what you can focus on. I think if our audience were just to take away those simple things, we've got Dr. Nicole's study that you've spoken about. We've spoken about cleaning up the diet, Sarah's book, all of the books, particularly the new one. I love that it's simple because, again, we're all busy. So there's some great resources that you can start to go to start focusing on just one thing and taking control of that situation. So I would like to thank you both very, very much for sharing your expertise with us today, for answering our questions. It is a conversation that needs to be had. So hopefully this conversation has sparked that for you in your lives with yourselves and with the people around you. So do join us next time on the 6th of December. We are going to be talking about goal setting. Sarah mentioned that, how important that is. So we're going to be doing a whole session on how to efficiently goal set and work with your mindset in order to actually achieve those goals, more importantly. So please do join us for that on the 6th of December. Thank you again, ladies, for a wonderful session, and we look forward to seeing you again soon.
Thank you. Thank you so much for having me. I loved it. It's fabulous. Thank you very much.
Thank you.